थैंक यू अनन्या, बहुत बहुत शुक्रिया आपका। और हम अपने अगले सेशन की ओर शीघ्र गति से बढ़ते हैं। और इस सेशन में हमारी जो मेहमान हैं वो बेहद ख़ास शख्स हैं, अदिति गर्ग। जैसे अनन्या ने आपका परिचय करवाया, ये आईएएस अफसर हैं, प्रधानमंत्री जन आरोग्य योजना की मिशन डायरेक्टर हैं मध्य प्रदेश राज्य के लिए। तो बहुत बहुत शुक्रिया दोबारा आपका कि आप आए यहाँ भोपाल से। और मैं अब सीधा आपसे पहले तो सवाल पूछना चाहूँगा इस योजना के बारे में, क्योंकि हम देखते हैं कि तमाम योजनाएं जो हैं वो भारत सरकार लाई है, बहुत लोगों को लाभ तो ज़रूर मिला है, मगर स्वास्थ्य क्षेत्र की बात की जाए तो प्रधानमंत्री जन आरोग्य योजना बाकी योजनाओं से कैसे अलग है मैम? और इसमें क्या खास है कि इतना ट्रांसफॉर्मेशन ये योजना कर पाई है इतने कम समय में?
थैंक यू। सबसे पहले तो मैं आपका धन्यवाद देना चाहूँगी, आपने मुझे यहाँ आमंत्रित किया और एक मंच दिया जिससे इस स्कीम की, इस योजना के बारे में मैं कुछ मुख्य पहलू आपके समक्ष रखूँ। देखिए, आपका सवाल जो है वो अन्य योजनाओं से प्रधानमंत्री जन आरोग्य योजना कैसे विभिन्न है, ये बड़ा महत्वपूर्ण है, क्योंकि ऐसी कई योजनाएं और भी अलग अलग क्षेत्रों में, राज्यों में चल रही हैं, प्रचलन में हैं। PMJAY, जिसे ज़्यादातर लोग आयुष्मान भारत कहते हैं, ये 5 लाख तक का कवर प्रति परिवार प्रति वर्ष दिया जाता है, और इसमें करीब 2000 ट्रीटमेंट्स मध्य प्रदेश में दिए जाते हैं। इस स्कीम का स्कोप मैं पहले थोड़ा समझाना चाहती हूँ। मध्य प्रदेश में पर डे 4000 ट्रीटमेंट्स हम लोग प्रोवाइड करते हैं इस स्कीम में। ऑन अ डेली बेसिस देयर इज़ अ बजट एलोकेशन ऑफ अप्रॉक्सीमेटली 4 crores पर डे। तो इससे बड़ी कोई अन्य योजना और हो नहीं सकती, जिसमें मध्य प्रदेश के लिए मैं आपको बता दूं कि करीब 80% ऑफ द स्टेट पॉपुलेशन इज़ कवर्ड। ऐसी कोई और योजना मैंने आज तक नहीं देखी है जिसमें इतने ज़्यादा लोग एक बार में एक स्कीम में कवर किए जाएं। देखिए, ये योजना अन्य योजनाओं से इसलिए अलग है क्योंकि ये योजना हर उस व्यक्ति के लिए है जिसे इलाज की आवश्यकता उसको या उसके परिवार को जीवन में कभी ना कभी लगती ही है, और उसे ये कवर करता है। एक परिवार के जितने भी सदस्य हों उनको प्रति वर्ष 5 लाख तक का कवर देना, ये एक काफ़ी अहम योजना है। और इससे जो हमारे गरीब तबके के लोग हैं उनका जो आउट ऑफ पॉकेट एक्सपेंडिचर होता है, आपको जानकारी है कि यदि किसी भी परिवार में कोई व्यक्ति गंभीर बीमार पड़ जाए और उसका जो खर्च उस परिवार को उठाना पड़ता है, उससे वो पूरे परिवार गरीबी रेखा के नीचे आ जाता है। तो ये एक ऐसी योजना है जिससे हम कोई किसी को मॉनेटरी बेनिफिट नहीं देते, या हम उसे कोई एक स्किल ट्रांसफ़र नहीं करते, हम उसे कोई काम करने के लिए सक्षम नहीं बनाते, परंतु हम उसे वो स्टेट स्पॉन्सर्ड सपोर्ट देते हैं जिससे वो आगे चल के अपने जीवन को सही रूप से जी सके, और जो उसे काम करना हो वो कर सके, उसे जो चीज़ें हासिल करनी हो वो कर सके। तो ये योजना एक तरीके से एक स्टेट स्पॉन्सर्ड सपोर्ट स्कीम है जो कि किसी भी तबके के वर्ग के लोगों के लिए बहुत ही अहम है।
मध्य प्रदेश अक्सर भारत का दिल कहा जाता है, और ये विशाल राज्य है। इस राज्य में पॉपुलेशन की संख्या भी बहुत है। सो हाउ चैलेंजिंग वाज इट फॉर यू टू इम्प्लीमेंट दिस स्कीम इन a state the size of Madhya Pradesh? Because if we talk about the population and the size of the state, it's equivalent to many countries abroad, ma'am. तो वो कितना बड़ी चुनौती थी आपके लिए, and how did you all go about implementing this scheme in MP? Tell us a bit about that.
So very rightly you have put that across, that Madhya Pradesh implementing Ayushman Bharat is almost like a scheme being implemented in any of the European countries, or maybe say Canada. It is approximately the same scale. The population of Madhya Pradesh is approximately 7.5 crores. Ayushman covers 4.5 crore people. So almost 70 to 80% of the state population is already covered under this scheme. The important thing that we have done in the state is that we have ensured that access to the scheme is 100%. So already almost 80 to 90% of the state is covered in terms of having an Ayushman card. You know, a card is not of much significance, but if you give it to a family that is not aware of the scheme and you tell them that, look, this is your card and on this card you can avail treatment up to 5 lakh, that means a lot to them. So it's very important to for the state to expand the scheme, and that is why we have ensured that 80 to 90% of eligible beneficiaries are covered in terms of having a card and a registered and their registration done under Ayushman. We have also ensured in Madhya Pradesh that 100% of the families have at least one member who has a card. In your family, if you know that one of the family members has a card, you know that at least everybody else can avail of the benefit.
Yes.
So we have, on a war footing, gone ahead and ensured that access is available. The second thing that we have done is that we have tried to ensure equitable access in terms of availability of hospitals. So Madhya Pradesh has, on a very wide scale, empaneled a large number of hospitals, whether it is public or private. We are trying to ensure that quality standardized care is also provided through our public institutions. For example, the medical colleges, the district hospitals, the community health centers, and down below. So there is a lot of awareness in Madhya Pradesh, and what I'm very happy with is that a lot of our public representatives, our spokespersons for the government, are constantly raising awareness for the scheme. I have rarely been to a public event where the scheme is not extolled, the virtues and the benefits of the scheme are not enumerated. So it goes a very long way in helping us implement the scheme at the grassroots level.
और मैं आखिर में आपसे पूछना चाहूँगा कि आगे का रास्ता अब क्या है? बहुत कुछ काम हो चुका है और आगे ये योजना का फ्यूचर का भविष्य क्या है? और मध्य प्रदेश जो है, जैसे आप कह रहे हैं, बहुत सफलता आपको एमपी में मिली है, वो मॉडल अन्य राज्यों में कैसे अपनाया जा सकता है?
So there are a lot of learnings from the state of Madhya Pradesh that can be taken up by other states who are willing to expand in Ayushman Bharat. One of them, of course, is that we have widened the beneficiary net base. We have ensured entrenched access to the scheme, sufficient publicity and awareness, and IEC activities have been done. But most importantly, I feel the government has, on a war footing, gone ahead with ensuring that hospitals that are providing treatments under Ayushman are also fully accommodated to the extent that they can be accommodated under the scheme. So I think those are massive learnings. What the road lies ahead for Madhya Pradesh in terms of the future of Ayushman Bharat, I would say we have to move towards digitization of Ayushman Bharat. The state of Madhya Pradesh is implementing the Ayushman Bharat digital mission, under which we will soon have digitally linked records of beneficiaries and easy access to those digital records. As you would know, whenever we go to take treatment, we usually have to carry huge documents, X-ray sheets, prescriptions. Whenever we go to meet a doctor, हम लोग हमेशा वो अपना पुराना prescriptions और वो सारे reports लेके चलते हैं. The idea is that Ayushman Bharat should be a digital enabler. It should also provide for equitable access through the digital platform, so that a person who is going from, say, Madhya Pradesh to any other state, whether it is Delhi or Bombay or any other state, can make use of the benefit of portability of the scheme. Okay. Suppose I am an Ayushman beneficiary. Ayushman Bharat allows me to take the treatment in any state across the country. So it should be easy for me to take that treatment. I think that is the portability and the technology adaptation is where Madhya Pradesh is going to focus on coming forward. Okay. And at the same time, we have our yet to be reached areas, the very deprived sections and the very distant, unconnected parts of the state that we are hoping will come forward and be connected through the scheme. So, as you said, we are the heart of the country, but we believe in preserving and keeping the heart very healthy. So we want it well connected. Thank you.
बिल्कुल, बहुत बहुत शुक्रिया आपका अदिति गर्ग जी कि आज आप यहाँ हमारे हेल्थ कॉन्क्लेव और सुश्रुत अवार्ड्स पे आज आएँ और मैं आपको बधाई देता हूँ कि कितना काम हो गया है इस स्कीम के तहत मध्य प्रदेश में, और शुभकामनाएं, क्योंकि जैसे आप कह रही हैं कि आगे का रास्ता भी कठिन है, मगर आप इस चुनौती के लिए पूरी तरह से तैयार हैं।
बहुत बहुत शुक्रिया अदिति गर्ग जी आपका हमारे साथ इस कार्यक्रम में आने के लिए, हमारे साथ जुड़ने के लिए, और आपका भी बहुत बहुत शुक्रिया उदय। और इस सेशन में हम आगे बढ़ेंगे। आगे हमारे आपको बता दें कि जन औषधि द रोड अहेड की नोट्स प्रेजेंटेशन बाय श्री अरुणेश चावला, सेक्रेटरी फार्मास्यूटिकल्स GOI। आई वुड लाइक टू रिक्वेस्ट श्री अरुणेश जी, प्लीज कम ऑन स्टेज। अरुणेश जी हमारे साथ हैं। सर प्लीज कम ऑन स्टेज फॉर दिस प्रेजेंटेशन। जोरदार तालियों से स्वागत करिए जन औषधि द रोड अहेड। जन औषधि को लेकर ये प्रेजेंटेशन होने वाला है जो अपने आप में खास है। कैसे जन जन तक औषधि पहुंचाए, जिसको लेकर गवर्नमेंट की साइड से जो टारगेट्स रखे जा रहे हैं, जो प्लानिंग की जा रही है, इसको लेकर तमाम चीजें हमारे साथ की नोट प्रेजेंटेशन के जरिए आप साझा करेंगे। सर प्लीज कम ऑन स्टेज।
Friends, as per the scheduled program, Mr. Ravi Datich, who is the CEO of Jan Aushadhi, will introduce the subject, the concept of Jan Aushadhi, and will give the details about its functioning. And that will be followed up by me, a few thoughts on the road ahead. So I'll request Mr. Ravi Datich, CEO, Pradhan Mantri Jan Aushadhi Pariyojana, to address the audience. Thank you.
Thank you, sir. Jan Aushadhi Pariyojana is a flagship scheme of Government of India, which is under Department of Pharmaceuticals, Ministry of Chemicals and Fertilizers, and with an objective of providing affordable medicines to all the Indian citizens. The scheme is run by the Government of India through a society which is called Pharmaceutical and Medical Devices Bureau of India, PMBI, and it has opened over last 10 years around 10,000 Jan Aushadhi Kendras in the entire country, covering almost 750 districts in all the 36 states and union territories. With this scheme, every citizen who gets a prescription from any doctor without any other authentication, he can simply, like any other medical store, he can visit these Jan Aushadhi Kendras and purchase his medicines, and these medicines are priced at 50 to 90% cheaper than the branded counterparts. When these medicines are priced at such a low price in comparison to the branded versions, sometimes a doubt is casted that whether these medicines have the same efficacy or same effectiveness. So for meeting this challenge, we ensure that all these medicines are procured through WHO GMP certified manufacturers only. And after receiving all these medicines, these are tested again in NABL accredited labs again, so that we are ensured of its quality, and after satisfying ourselves that these medicines have fulfilled the requirements of the prescribed chemical composition in respect of its dissolution or its assay, we supply these medicines to our distributors and the retail counters. Over a period of last 10 years, the number of Jan Aushadhi Kendras have seen a growth of more than 100 times. There were only 80 Jan Aushadhi Kendras in the country in year 2014, and these have increased to more than 10,600 number in year 2024. Simultaneously, the acceptance of these generic medicines has been also wide. Earlier, there was only say around 8 crore worth of turnover in year 2014, which has now increased to around 1400 crore in this financial year. So in respect of its diversity also. There were only some 200 kinds of medicines 10 years ago. Now we provide around 2,300 medicines and surgical devices. It covers almost 40 therapeutic groups, covering all major like cardiovascular or orthopedics or ophthalmology, means all medical therapeutic groups which are there, the medicines pertaining to these are available. And people are finding it very interesting when they save money on the regular purchase, because people having chronic disease, they have to purchase medicines compulsorily on a regular basis, and they save a lot of money while they purchase these medicines from the Jan Aushadhi Kendras. In addition to these medicines, there are other interventions by this scheme. For women's hygiene, we provide sanitary napkins at ₹1, or a pack of 10 is sold at ₹10 only. Over a period of last 4 years, we have sold more than 50 crore sanitary pads covering all these Jan Aushadhi Kendras, and these have also been accepted with great enthusiasm in the entire country. So in this manner, the out-of-pocket expenditure of Indian citizens, which is done on medicines, has been reduced greatly, and with the directions of Honorable Prime Minister and Honorable Health Minister, we have been taking steps now to increase the number from its 10,000 presently to 25,000 in the next 2 years. So this tremendous growth which is anticipated, for which we are planning, then these Jan Aushadhi Kendras will be available in all the block level and all the districts of the country, and people will be able to get the benefits of medicines, of cheaper medicines and good quality medicines. Yeah, thank you.
Thank you very much, Ravi. The commanders on the ground must always of the glory. And as Ravi explained, the Jan Aushadhi Pariyojana started in a small measure in 2008. And till 2014, we only had 80 Jan Aushadhi centers in the country. It served as a learning experience and a base platform. Our Honorable Prime Minister and our Health Minister, who heads the initiative in our department, they envisaged a fast growth and expansion of this scheme to all parts of the country, so that high quality and affordable generic medicines, 50 to 80% cheaper than the market, can be made available to all. We are very happy to note and announce that in a span of 7 to 8 years, from 80 we expanded to 10,000, and the 10,000th Jan Aushadhi Kendra was inaugurated by the Honorable Prime Minister in AIIMS Devghar very recently. And from the ramparts of the Red Fort, Honorable Prime Minister announced that we should increase the Jan Aushadhi Kendra. He set a target of expanding it to all districts, blocks in the country, and increasing the number to 25,000. And we are presently on the job. We have already crossed the 10,500 mark. In terms of, just wanted to briefly talk about the way forward. We are working both on the extensive margin and the intensive margin. In terms of our extensive reach, we propose to take Jan Aushadhi Kendras to all districts and all blocks of the country in the next 3 to 4 years. And with that, we also plan to increase the coverage of medicines and devices. We've already covered around 200,000 medicines and 300 devices. And we are working to create a minimum stocking mandate, which essentially means we take the top 100 products from the Jan Aushadhi portfolio. We also look at the top 100 branded products selling in the market, And from them, we take out the common generic drugs, and we are working very hard to ensure and create this stocking mandate in future so that the common medicines in generic form, quality certified and affordable, are available to all citizens. And medicines which are not immediately available in stock, a mechanism is created so that a customer or a patient can leave his phone number, mobile number, and they can be procured and a call goes back to him that such a medicine has become available. Our emphasis on quality is high, and it is going to be even higher. We procure generic medicines only from WHO GMP certified plants. And they come to our warehouses. There are about 6 very large warehouses in different regions of the country. We don't rest at that. Following the policy of respect all, suspect all, from every batch we take a random sample and we send it to accredited laboratories, and samples which pass the quality test of the Jan Aushadhi scheme are allowed to go down to the distribution network and to the retailers. So Jan Aushadhi, if you see a Jan Aushadhi medicine only has the generic name on it. It does not have any brand which confuses patients and which confuses doctors. With that name, with that generic name, it has a Jan Aushadhi logo. And so that when you see a Jan Aushadhi logo, you see a packing, you see that medicine, you are sure about the quality that goes behind it. And in future, we are also going to bring in a QR code mechanism and a track and trace based on modern technologies like blockchains and AI, so that with any app that scans a QR code, you are able to actually see and test. It will tell you the medicine is genuine, where did it originate from, what was its batch number, so that customers, citizens have full confidence in buying a Jan Aushadhi product. We have thousands and hundreds of success stories where ordinary citizens for ordinary illnesses who used to spend 10,000, 15,000 on medicines every month out of pocket, now they spend 3,000, 4,000, 2,000, almost 8,000 less. And as you know, the largest cause of marginal poverty in India is the out-of-pocket expenditure on medicines, and Jan Aushadhi Pariyojana has made a huge difference, and we continue to keep doing this good work and ensure the benefit of this great scheme reaches every citizen in the country. Thank you.